What is diabetes? Diabetes is a disease state where there is an increased amount of glucose, more than the required amount of glucose in one's bloodstream. So, where does this glucose come from? The food that we eat that gets digested, especially the carbohydrates in your food, it will get digested and converted into glucose, which is then absorbed into our bloodstreams. In persons without diabetes, the pancreas will immediately secrete enough insulin so that this glucose is taken up by our cells and used as energy or stored for later use. What happens with people with diabetes is that there is not enough insulin being secreted by pancreas, or in case of type 2 diabetes, there is enough insulin that is getting secreted, but their bodies are not responding well to this insulin. Their cells are not responding to insulin and taking up and storing or using the glucose. This causes the blood glucose levels to remain high for a long period of time after your meal. And this high blood glucose can lead to damage to our vital organs. Hence, it is really important that our high blood sugars are detected early and corrected. So let's look at the early warning signs, or what are the early signs of diabetes. One of the earliest signs that you can see is called Acanthosis Nigricans. Darkening of skin behind the neck and in the armpits is called Acanthosis Nigricans, and it can be an early sign of insulin resistance. Another early sign or symptom of diabetes is fatigue. Even though the person is eating and the glucose is getting till their bloodstream, their cells are not able to use this glucose. And this means that the cells are not able to efficiently utilize the glucose for energy, and the person will feel tired. And another sign is slow healing of wounds. The increased level of glucose in the blood makes tissue repair harder. So small cuts or wounds will take long time to heal. Also, there will be an increase in infections, minor infections like skin infections, nail infection, gum infection. All this happens because the high blood sugars will reduce one's immunity and make one more prone for infections. Then there is the classical triad of diabetes, that is the polyuria, polydipsia and polyphagia. Of this polyuria or frequent urination is often the first one to come. Because there is high glucose in one's blood, that will push more water out through your kidneys and the person will start peeing more often. And when one loses a lot of water through urine, they'll start feeling thirsty, and this causes an increase in thirst. Frequently what happens is that at night the person with diabetes will have to get up multiple times to pee, and they'll be feeling thirsty. Then they'll drink a lot of water, then they'll pee again. This is one of the earliest signs of diabetes. And also, because the cells are not getting enough energy, they'll be always feeling hungry. They'll be eating more, but there will be loss of weight also, because even when you are eating more, the energy that you are supposed to get from your food is not getting converted to your cells. And what happens is that your body will start utilizing your muscles and your fat cells for energy because it's not able to use glucose. This will mean that the person with diabetes can be losing weight. But it's always better to detect the diabetes before it reaches this stage of weight loss and all, because by that point the blood sugars would have gotten really high. Then there are signs of complications of diabetes, like blurred vision happens because the high sugars will increase the water content of your lens, and it can also affect your retina and can cause blurring of vision. Similarly, the high blood sugars can damage your nerves and cause tingling and numbness of your feet, pain at night, like some people present with joint pains. Frozen shoulder is one of the earliest signs because of long-standing high blood sugars. We need to detect these high blood sugars before they cause such symptoms early. For that, you need to understand your risk factors. The risk factors for type 2 diabetes can be genetic, lifestyle related, and environmental. Understanding these risks will help identify the diabetes early on at a point where it might be possible to reverse it and normalize it. So there are two kinds of risk factors for diabetes. That is non-modifiable risk factors and modifiable risk factors. Non-modifiable means it is inherent to your genetics and your body, and there is nothing you can do about it. It's like one's race or ethnicity. Indians and South Asians in general are considered high risk ethnicity for diabetes. Likewise, one's family history. If one's parent or a sibling or a first degree relative has diabetes, then that puts them in a high risk category. Likewise, age is an important risk factor. After 45 years, the risk of getting diabetes increases. Gestational diabetes is another non-modifiable risk factor. If a woman develops diabetes during her pregnancy or delivers a baby more than 4 kilos in weight, that is an independent risk factor for developing type 2 diabetes later in life. There's nothing that you can do about these things. Then there are the modifiable risk factors like a sedentary lifestyle. Less physical activity means less insulin sensitivity and the more risk of diabetes. Obesity, especially the visceral obesity, will increase your chances of insulin resistance and diabetes. Unhealthy diet. Diets high in processed foods, sugars, unhealthy fats, and low in fiber increase the risk of developing type 2 diabetes. A poor diet can increase your chances of getting insulin resistance as well as type 2 diabetes. Smoking increases the risk of type 2 diabetes. Even nicotine will interfere with the insulin's ability to control blood glucose and cause insulin resistance. Chronic stress, long-term stress can lead to elevated blood sugar levels and may increase the risk of type 2 diabetes by affecting insulin function and causing hormonal imbalances. Sleep disorders like poor sleep, sleep apnea, insufficient sleep can also increase the risk of diabetes by increasing the level of stress hormones in your body. The stress hormones like the glucocorticosteroids directly causes insulin resistance, and hence the things that increase your body's stress levels will also increase your chance of getting diabetes. And if you're pre-diabetic, if your blood sugars are already detected to be on the higher than normal level, then that puts you at a higher risk of getting diabetes later in life. People with high blood pressure above 140 over 90 millimeters of mercury, are also at risk of developing diabetes, because all these are part of insulin resistance, and insulin resistance causes high blood pressure, high diabetes, PCOD. Women with PCOD, which is again another sign of insulin resistance, are at higher risk of developing diabetes, and also high cholesterol levels. Because these are all part of our lifestyle that causes diabetes, these can be combined together and called as metabolic syndrome. So if you address these modifiable risk factors of diabetes, like by changing your lifestyle, increasing your level of physical activity and controlling your diet, and maybe losing weight, if losing even 5% of your body weight has shown to reduce your risk of diabetes significantly. And for those who are at risk of diabetes, it is important that you keep checking your blood sugars, monitoring your blood parameters frequently, so that even if you develop diabetes, you can detect it early and make the changes, or maybe start the medicine early so that you don't go into develop the complications. So how can you test for diabetes? The commonly used tests like fasting blood sugars. If your fasting blood sugars are more than 125, then it is considered as diabetes. But if your fasting blood sugars are between 100 and 125, then that can be pre-diabetes. Likewise, your blood sugars after food. If it is more than 200, then it is definitely considered as diabetes. And if postprandial blood glucose levels between 140 and 200 can be considered as pre-diabetes. HbA1c is a test that tests your 3 months average blood glucose. This can detect high blood sugars even before your fasting and after food blood sugars go up, because sometimes the blood glucose rise happens during sleep. and that cannot be detected by our usual tests. So an HbA1c test may at least once in a year in a high-risk people will be beneficial. HbA1c below 5.7 is normal. 5.7 to 6.4 means pre-diabetes, and more than 6.4 is diabetes. There are other tests like glucose tolerance test that is usually done in pregnancy to detect response to a load of 75 gram glucose when taken and your blood sugars measured. You can detect early diabetes. So these are all the regular tests that you do to detect diabetes. Then there are the more advanced tests. There are certain indexes like insulin resistance, HOMA index, Tukey index. These detect your risk for insulin resistance. For that, you just have to simply do your blood glucose, fasting blood glucose and your fasting insulin levels. And from that, you can calculate your risk of developing insulin resistance. Continuous glucose monitoring is another test. If you are a diabetic or pre-diabetic individual, we can use continuous glucose monitoring to see how your blood glucose is responding to your day-to-day meals. That's important because most people respond differently to different meals. Something that can cause a glucose spike in one person, like in idli, may not cause a glucose spike in another person because each person's body is different. HbA1c or fasting and after sugars may not detect high or borderline high glucose happening throughout the day. So CGM can identify abnormal spikes that are happening in your blood sugars even if your other blood parameters are normal. Similarly, lipid profile, your blood cholesterol levels, can also indicate your risk for insulin resistance. High levels of LDL or low levels of HDL and high levels of triglyceride or an increased triglyceride to HDL ratio, these are all markers for insulin resistance. So once you identify your risk factors and you keep monitoring for your blood parameters that can increase your risk for diabetes, and you adopt a lifestyle that reduces these risk factors, you can delay and even prevent the occurrence of diabetes and the many complications that happen with it. So if you are someone who is suffering from diabetes, or if you have family member who is suffering from diabetes and you are at risk of diabetes because of your lifestyle or diet, get checked and identify your risk factors and let us know in the comments if this video has helped you in any way. Thank you.